What if parts of your journey in medicine, including setbacks, are actually what shape you to be the doctor you're supposed to be? My journey from pre-med to medical school to eventually matching in my dream specialty of psychiatry was not linear, to say the least. Multiple exam failures, health conditions, and a leave of absence are just the tip of the iceberg for the struggles I faced matching. These challenges aren't usually talked about in medicine, but here we do. Your path does not have to be linear, nor look like anyone else's. Hello, my name is Dr. Moss. I am a PGY2 Psychiatry Chief Resident, and today I'll be talking about my path, my full path from pre-med through medical school and then matching in psychiatry. Why did I choose psychiatry? If you stay till the end, I'll be sharing some secrets about what my path has looked like and some very interesting patient examples that led me to choose psychiatry. Let's turn back the clock 10 years. A little bit about my journey, my pre-med timeline. So I grew up, born and raised in Boulder, Colorado. So I chose to go to University of Colorado for undergrad. At first, I knew I wanted to do pre-med. So the pre-med major was the integrative physiology. So I did that for the first semester, and then I did an elective in psychiatry. And I really just fell in love with it. I was just thinking, the DSM-4 had just come out. I have all the DSM books from the past couple generations in my workroom. So that really I think that was the first time psych really caught my attention. I ended up realizing I'm going to change my major. With psychology, I don't know what that will do with going to medical school, but we will see. At that point, I also did my chemistry. My second year is when I did my OChem. Third year is when I then did physics. That's when I then became the resident advisor. I was a resident advisor to pay for the housing. I got my EMT certificate. It was an advanced EMT, so like on weekends and during the summer, I used my EMT to start volunteering in community health fairs. So ended up doing healthcare volunteering, like getting people's blood pressure, taking out blood. I speak Spanish, so I love doing the health fairs because I got to go out there and really connect people with healthcare who did not have that opportunity normally. And then I started doing more volunteer work. And after a couple times that I volunteered, I ended up becoming one of the leaders, like running the lab at some fairs. And then eventually I even started running the actual huge health fairs. I became one of the medical coordinators. That was my huge volunteer job that I did throughout undergrad. So I really fell in love with doing that. I had to work during college. So ended up doing EMT because I was like, okay, this is what I heard you're supposed to do. There's supposed to be jobs. So that was my goal. Unfortunately, didn't end up finding a job for my EMT. I ended up using my EMT to work as a caregiver for the elderly. And so I worked in assisted livings, independent livings, all the livings, and I actually fell in love with it. I was really scared at first of working with older individuals because I had always done kids. I used to be a martial arts instructor, so I was used to the younger side of things, but I fell in love working with older individuals. And then in M4, when I was in my last year of college, I was like, okay, I still want to do med school. So let me just try this MCAT. I've already done all my requirements, chemistry, physics, bio, all that. And then I failed. Then I failed the MCAT and it was horrible. I ended up having a full-on panic attack. At that point, I was with my now husband, but we had dated all throughout college. He was also a pre-med, and we decided to do the MCAT together. Worst decision, because for those who haven't taken it, when you see someone else get up, especially your partner, your best friend, I was in my mindset, I'm going to do snack breaks with him. Yeah, no, he's super fast at taking tests. So I ended up panicking. It did not go well. So at that point, we decided to take a gap year to re-study for the exam and try to apply to medical school. At that point, I'm done with college. I needed a full-time job, and the caregiver was not paying much. It could not allow us to keep living. So I ended up getting a job as a case manager just with at that point, my undergrad degree, my bachelor's of arts. I got into the world of working with children with disabilities, getting them connected to their Medicaid. And that was amazing. I really fell in love with working with individuals with autism, with different spectrum of disabilities, both physical and invisible. I think that must have been the first time I really got open to the disabilities. And then I applied to medical school. And I was just thinking today when I was like, oh my goodness, I'm talking to FAU. I actually interviewed for medical school at FAU. Both my husband and I did. I thought that was really funny. One of the medical schools we went to when we interviewed, because my husband and I, we got married at that gap year. We both applied to medical school, and there's no couples match like there is for residency. So we ended up just applying to all the major cities and all the schools in the cities, because I had a lower MCAT score. I think I did a 505. I did all the DO schools and all the MD schools that were in the big cities. And we actually had the opportunity to get into multiple MD schools. We were very lucky. So we had the opportunity to choose between Florida, Pennsylvania, and Chicago. And we chose Chicago because it was the most similar to Colorado. And we're very glad we did. Going into my medical school, we moved from Colorado to Chicago. We both went to Rush University Medical School in Chicago. And M1 year went okay. It was very difficult to adapt. It was a very different way to study. It was hard being in a completely new city. We were in definitely a difficult part of town, very low income. So it was definitely a huge struggle. And then March is when COVID hit. We went virtual, and at that point, we actually were volunteering. Right before COVID hit, we were leaders for a homeless shelter. So there was a clinic connected to the homeless shelter, and we were leaders for that clinic. So then when the week of COVID, when they shut down, they also shut down the health clinic. And that really bothered my husband and I, because we were like, where are they going to get their medications? Especially at this point in COVID, we knew that they were the most at risk for COVID. So we ended up connecting with other leaders in the community and forming CHARGE, which is Chicago Homelessness and Health Response Group for Equity. So it was a group of all the homeless shelters in Chicago, like all the leaders of the Chicago, the health department, all the people that have something important to do about it. So like connecting them with vaccines, with masks at that time, with medications. So that was a lot of what we did. And for me, it was very important because at this time in COVID, all the medical students were being pulled back. We weren't allowed to do anything in person, but all the other doctors, all the other people that were so focused on helping, they were being called in. So I felt that it was really important for us to do something because we were being sidelined. So that's where I created this volunteer group of medical students. How can we volunteer virtually? How can we raise money? How can we make care packages and drop them outside of people's houses? So one person would make little baggies of Tylenol. And then after they were done, they would pass them on. They would drop them off outside one of another med student's house. And then that med student's house was in charge of putting all toothbrushes, for example. So we did that class until they were all full little, like huge Ziploc bags filled with care packages that they would need for COVID. And then someone ended up dropping them off at the shelter. I haven't talked about that or thought about that in a long time. But yeah, that was back in 2020, 2021. And then that was also during second year. So at that time, that is also when I eventually got diagnosed with mental and physical health conditions, got diagnosed with anxiety disorder. I got diagnosed with PTSD because of my childhood trauma. All this stuff that I didn't really have the diagnosed opportunity. I had now the opportunity. I was learning stuff in books. I was like, wait a minute, this sounds like something I have. I thought this was normal. I thought it was normal to be anxious about every single thing. I thought it was normal to have nightmares all the time. That is how I eventually got diagnosed. And then that was fail step one, which is the first board exam. And my best friend, she was like, hey, weren't you just diagnosed with all these health conditions?
why don't you ask for accommodations? And that's when I was like, I don't even know what accommodations are. I've never had that ability. Yes, I've always struggled in school. I've always worked extra hard. Like, you can see me, I'm here right now, not just for the meeting. I was still writing notes. So I definitely put extra time to my notes and talking to my patients, but that's just me. But going back to USMLE. So anyway, I applied for USMLE accommodations. I was given extra breaks because I was also diagnosed with endometriosis and interstitial cystitis. So I could not go to the bathroom in the less than 10 minutes that they give you for a break, which is also the less than 10 minutes they give you for the MCAT breaks. That was definitely really helpful to take care of my needs, to take anti-anxiety medication, to take deep breaths and work on that. Now I'm thinking during all this time, I'm also supposed to be studying for my exam. Some point at this, I forgot that I had to take leave of absence. So I was pushed into leave of absence to study for this exam. And also, big thing about leave of absence is that they take away your student loan. So I had to figure out how I'm going to work. So I ended up doing multiple different little jobs and ended up working as a medical assistant in a pain clinic. So without even a medical assistant degree, they let me work just because I said I was a medical student, and was really helpful because I could study during it. Another thing that I got because I'm also very interested in mental health and trauma, I ended up getting a certificate in somatic trauma therapy. So online, I had been watching virtual lectures on trauma therapy, and this opportunity came up to actually get a certificate. So that was a great opportunity, and that actually was definitely part of my journey of going to psychiatry. Then I went to M3 year. In M3 year, I was really set on family medicine. I thought I was going to apply to family medicine. I liked all patients, all from babies to adults. I liked sitting and talking with patients. But what I noticed is I wasn't able to just sit for a significant time about what my patient needed. It was more on check marks of, oh, they need to get this preventative, they need to get this meds, oh yeah, and you need to do this in less than 10 minutes. Versus psychiatry, especially when we talk about inpatients, where I am right now, I can sit and talk with my patients for 30 minutes, an hour. There was definitely more flexibility and encouragement to just talk to what the patients needed. Very patient-centered. And then an outpatient, same thing. They were 30 minutes in an hour-long appointment, and it was all based on what the patient needed in the moment. So that's when I really started to be really interested in psychiatry and be like, okay, what is this? And then in every single rotation, from pediatrics to surgery even, I was finding patients that had mental health conditions. So you ask, why surgery? Transplant surgery. I was doing a transplant surgery rotation. Who are the ones receiving livers? A lot of the time, it's individuals who had struggled with alcohol addiction. So that was a huge patient population that I was really interested in at that. I also worked when I was on inpatient child. I found some patients that had something called PNES, which is psychogenic non-epileptic seizures. So that is also a psychiatric and neurological condition. So in every single rotation, I just kept falling in love with patients that were very much psychological based. And then M4 year, that's where I decided, because of the quote red flags when we're thinking about failure of step, leave of absence, health conditions, you could say that. And to just add something to the mix, my husband, he had to go on to a year ahead of me. So he was now an intern in neurology. And so it was really important for me as my biggest support system to stay in the area. So he matched in Chicago at Rush. And so I applied to all the programs, just like I did for medical school. I applied to all the programs in Chicago, and then within 4 hours, all the family medicine, all the psychiatry programs. and then did a dual application, which was very difficult because I had to get letters of rec from both places, do electives in both specialties, conferences in both specialties. And then lastly, something that I started during that year was I had before started writing about my experience. I learned that was an emotional thing through my journey of struggle. I guess in the past I'd always journaled, but now I learned that part of my own mental health treatment was to share my struggles so others wouldn't have to undergo similar struggles. I created a blog post, then I realized that people don't like reading blog posts, so then I started actually reading my blog posts into a podcast, into a video. So that was how my life as a patient doctor podcast and videos started. I'm going to pause there because I just gave so much information about me in 20 minutes. I talked about my pre-med journey and all of my medical school journey. So I'm going to pause before I go into residency and psychiatry. Does anyone have any questions that I can answer about the story so far or my journey? And time for water. You can put in the chat too. You can also pull up.
I don't see any.
Yes, please.
With your leave of absence, do you think that hurt you when it came to matching, or did that come up a lot when you were going through interviews?
What a great question. And it's something that everyone always gets the most scared about. Will my red flags be talked about? And the thing is, when people are the ones that are interviewing, and I even help interview right now for both people that are applying to medical school and people that are applying to residency, usually all we get is your personal statement. So if you don't include what your red flags or your biggest struggles, like a gap year, like a leave of absence, like an academic failure, there's no way that we'll know about it. And so that's what I did for my own personal statement. I didn't include it because that wasn't part of the things that I'm proud about and the reason I want to go into psychiatry. Same thing when I was applying to medical school. My gap year was just a thing that happened. It wasn't the reason that I am who I am, so I didn't include it and they didn't ask. Now, the people who are more likely to ask and who did ask is people like the program director that have my full application, or if it was admin for applying to med school, they see it. And usually when they ask tell me about it, or what challenges did you experience, or what did you learn, or how will that experience help you? For me, I wrote actually a lot in my activities section that I worked in the pain clinic and how that taught me how much individuals with chronic pain suffer. I did another activity on my somatic trauma therapy and how that really opened my eyes of the type of therapy and the type of treatment I want to do. So if they asked, I was prepared to talk about it in a way that shined my strengths and what I grew about it and how I was going to be a better doctor or psychiatrist or family medicine doctor, because I was interviewing for them too. So I hope that answered your question, because it's definitely something everyone asks about.
Yes, it did. We have one question in the chat.
Yeah, what can you read it? Because I saw it blink up.
Was there a turning point that let you knew immediately you should be doing psychiatry?
I think in psychiatry, like actually going to inpatient psychiatry. And there was actually a specific patient even that I wrote a blog post about that was catatonic. She was a law student. So just like me in med school, but a law student. She had failed an exam and that led her to become catatonic, where she wasn't eating, she wasn't talking, she wasn't moving. She was just stuck. And I saw her at that point, and I just couldn't believe that. At that point, I had never even heard of catatonia. And then they ended up doing ECT on her. And I write in that blog post at first of how scared I was of ECT because I didn't know anything about it. The only thing about ECT I had known is from those horrible videos that they make of like social media, of like how people are having the full seizures, and then going to the rotation in my psychiatry where I got to help doing this ECT, and I realized, oh, this is not a big deal at all. We put them to sleep. They're in surgery. We have an anesthesiologist that just puts them to sleep. And then I even helped put the ECT of putting it, and it induces a seizure, but we don't even see the seizure. And I actually just talked with a patient today about it. It's like a hard reset. Just like we put when someone's heart stops, we have to put and shock their heart back awake. That's exactly what we're doing before the brain. We're shocking the brain to have a hard reset. And the reason I bring that up is because I saw that girl go from not being able to talk or eat, completely depressed, to slowly over many treatments come back to literal life. And talking with her about she just seeing how she changed and she literally came back to life in front of me over those weeks of treatment. And I remember the very last day that she was going back to law school even. And I think I connected with that because it was right after I had failed step one, and not right after, but within the past year. And I remembered, and I even told her, I'm like, I failed step one too, or like my equivalent to your law degree. And I remember how depressed and suicidal I was too. And so being able to have that connection with my patient and letting her know she wasn't alone, that I think was the moment that I realized that this is my passion and this is where I'm supposed to be. So that was a very long-winded answer. Any other questions? In terms of step two, anything you felt you did differently? Oh, good question that someone asked. Okay, so for step two, the biggest difference is I'm in clinicals. We're in clinicals. So we're actively learning about patients. We're learning about medications. We're learning this is what a heart attack looks like. This is what depression looks like. This is what kidney failure looks like. And then at the end of every single clerkship, you do an exam. So you do a mini step two, but just on, if you're in surgery rotation, you do it on surgery. When you're in OB-GYN, you just do it on OB-GYN. So I was doing a mini exam at the end of every single month rotation, or sometimes 2 months rotation. So because of that, I was spending a full year studying for that exam versus step one, we're only given 6 to 8 weeks. And having that ability to study, to practice on step two is also where I got more accommodations. I think I was able at that point to not just ask for break time, but actually increase to, I think I got 1.25. So I noticed that I was always the last, because it's usually 40 questions in an hour. Let's say right before the hour hit, there was still 2 to 3 questions that I just couldn't, even I worked super hard, I could never read them in time. And so I had to just pick whatever, the C or whatever. And so by articulating that in my accommodations application, saying, I'm seeing psychologists, I'm seeing my doctors, I'm working super hard, and my school has now given me that sort of accommodations. They were able to give me accommodations. So that was a huge thing of how I was able to not just pass, but do pretty well on step two. I think I had 229. So let that be, just because you fail step one or MCAT doesn't mean that you won't do well. You just need the supports that are best for you. What else? What other questions? Now I can go to psychiatry. Talk about what did you do for yourself? Oh, what is that? To prevent burnout. Oh, I hit burnout so many times. There was no prevention of burnout. How I got through burnout, I should say, is I had a psychologist from my first year of medical school. I came into medical school knowing I will struggle with my mental health. This was before I got diagnosed. I was like, you know what? This is already a new state. I don't have any friends. I don't, like, of course, my husband, who is also going through the same thing as me, is I know I need help. And so from the very first year of med school, I got connected with my therapist, and I've kept the therapist all during COVID, all during my leave of absence, all during third year, fourth year. And now I meet with him every Thursday. I met with him yesterday, like the exact same one that I did from first year of medical school. So that was number one, big. Two is making sure that I had my support system. For me, it was my husband, and we had developed this even since college, that in order to maintain our relationship, we knew that we had to spend time just with each other. So we decided that every day, either at breakfast, lunch, or dinner, we would have to have one meal together. No studying. Even though the rest of the day we would be studying or in school, but at least one meal a day that we're meaningfully either watching Netflix together, going on a walk, and having a picnic. That was definitely one of the biggest things. And I say literally, and keep going positively. So great question. Yeah, let's go on to the next one. Thank you for all your questions, everyone. Okay, PGY1. Oh, I can't believe it. I'm already in PGY2. So PGY1 year is, I talked about, I love writing. I love writing about my experience. And so I became a Doximity fellow, where they paid me, not that much, I think it was $1,000 and then minus tax, but for an entire year of writing for them. So if you go to Doximity, you can see some of my writings, and I took that very seriously. I called medicine out. I talked about professionalism because I got in trouble in medical school for professionalism and speaking my mind. I called out not caring about males with sexual assault. So yeah, I really tried to take that opportunity as a Doximity fellow, sharing my experience from either personal or being a physician and noticing different patients and their struggles and articulating that through a story. So I think that was also very therapeutic and helpful. Let's see. I started a mental health research group because I noticed that a lot of the time when I was in medical school, it was really hard to find research, even in undergrad. And so I developed a mental health research group with medical students, where whenever I have an interesting patient, like I have a patient right now who has dissociative identity disorder, also called multiple personality disorder. So they're going to be helping me write a case report on it. We've done multiple case reports on different unique patients. We've done a survey on leave of absence. We created a workbook for group therapy. So last year, we took some of my things and we created a group therapy curriculum, and I actually used this to do group therapy on my units. I loved doing that. And then so psychiatry, the first year, it's like half the year is doing like medicine things, half is psych. So I got to do inpatient psych, substance use psych. What else was that? Yeah, those were the two main ones, because it's all inpatient when you're first and second year. So that's what I did. And then I also took step 3, and like always, I failed it. But thankfully, it was a whole difference by not doing well in residency, because since I was already in residency, they didn't care. And as I started sharing, as I've noticed before, by me being vulnerable myself and sharing, other people started sharing too. And I got to speak to so many people in my program and across the country that have failed their step exams. And particularly step 3, if you're not in a internal medicine residency, it's really hard to pass step 3 because it's fully all based on medications for medicine. So a lot of times Surgery residents struggle with it, psychiatry residents, optho residents, derm, like anything that's not just internal medicine, we struggle. So yeah, ended up retaking it and passing it later this year as a second year resident. And then I forgot to talk about call shifts. I actually did a call shift last Friday, where I did like a life in psychiatry call shift for another pre-med group. And so I need to put the videos all together. But usually I have an 8-hour shift like I am right now on inpatient. And then at 4 o'clock, I get the pager. And then I'm the only psychiatry doctor on the entire base. I'm at a Navy base, and it's huge. And this is a huge hospital. So like whenever there are people that come to the emergency room, I get paged and have to see them. Whenever there's a psych crisis of any patient who is having psychosis or physically hurting themselves or others, I get a psych crisis. If they're maybe delusional or on the medicine floor, maybe they're delirious because of an infection, that would be delirium. But maybe if they have dementia or Alzheimer's or Parkinson's, so that's patients. So that lasts, I have the pager from 4 p.m. all the way till 8 a.m. Thankfully, I am in a very lucky program where usually I get to sleep around midnight, from probably midnight to 6 a.m. I choose, because of my own health, I value sleep. We talked about burnout. That's how I prevent burnout. I just do my notes in the next morning. Some residents, even when they get a lot of patients, they still stay up till 3 a.m. and then they don't sleep. For me, it's important for me to sleep for even if it's a couple hours and then wake up before I have to give the pager at 8 a.m. And thankfully, I go to a program where I was very upfront with my disabilities and my needs, and they didn't have a problem with it. My program director didn't have a problem with it, and that's why also I'm a wellness chief, because I very much educate and advocate for our residents of no matter what your needs, and you should ask for them and you should receive them, because that is literally required by law if it's a disability. Or half our residents are Muslims, so like right now they are fasting, so we're covering all their call shifts during that way. They don't have to be on call while fasting. So it's very collaborative and important. And I don't know if that's just because we're psychiatry residents, we care about each other, and we're just in a good program. But anyway, those are my 16-hour call shifts, which are really 24 hours from 8 a.m. to 8 a.m. Or I prefer not to do them, but we can do full 24 hours on call on weekend. I, again, choose not to and choose to do just 2 12-hour shifts. So on Saturday, I have a 12-hour shift, 8 a.m. to 8 p.m. But yeah, that was that. So the call shifts are first year and second year. Second year gets way more exciting. I was at Elgin, which is the forensics unit. So I really got to challenge myself with individuals who have murdering someone been deemed by the law, saying that they are legally insane. So it's usually schizophrenia or schizoaffective disorder. And we have to get them fit to go to trial. So that was really fun. Learned a lot. Also on geriatrics, which pulled in my caregiver memories. I felt like I was back, but now being the doctor, I was literally meeting my dream from being a pre-med caregiver of one day I could be a doctor that rotates at my facility. Now that was me a couple months ago. And then for third year, now I'm going to go all outpatient. So I'll have my patients for 30 minutes and 1-hour visits. I'll be doing psychotherapy with them. I'll be doing medications with them. And then I'll be fast tracking, applying to child and adolescent psychiatry, because I really loved being a caregiver for disabilities. And that's a lot what they do in child and adolescent, is working with kids with autism and disabilities. And I feel like that's where we need a lot more support. It's what I've been doing, is helping individuals apply for accommodations for their schools, for their USMLE, for their MCATs. And that's just me being a resident. I can't wait till I'm an actual physician and I can be writing the letters instead of just helping them with their letters. So those are my thoughts for the future. Any questions on psychiatry, what my psychiatry residency looks like? And one of the things you'll learn right away in psychiatry is that we are good with long pauses. I'm not. That is my problem. I am not good with silence, but I work on it. thinking to 10 in my brain. We can move ahead. That way we can actually get to what does it look like if you're shadowing or working on psychiatry. So I was originally going to play this. This is what I give to my med students of what it looks like to be on an inpatient psych unit, like different things to look for, especially when someone is new and you don't know if to trust them, like different safety boundaries of what to observe and how they're saying, how they're talking. So we won't watch it now, but I thought originally I was like, oh, we can do this, but it's too long. Anyway, so we can go to the next one and see it on your own time.
Unfortunately, we've ran out of time, but can I share your Instagram or email with the students?
If you go to the end, there'll be a QR code that actually shares my link to everything to make it easier. I just created a blog post to answer people's questions on MCAT and applying to medical school because I was receiving a lot of questions on that. So I did just create 2 blog posts and a video on MCAT, but it's on my to-do list to do one on applying to medical school. So things to come. Thank you all for being here and for asking your questions.